Assalamualaikum and a very good morning. So my name is Muhammad Hazmi bin Mustafa, matrix number of 192126. So this is my cat Roberto. So today I'm gonna demonstrating some kind of physical examination, fully physical examination that vet should check on a cat. So firstly, before performing the physical examination or the PE, always remember that you have to weigh the animal first, as the temperament of the cats or dogs may not be the same as before doing the PE and after doing the PE. So after taking the weight of the cats, so first there are two types of physical examination. First, distant physical examination and close physical examination. So we start with the distant examination first. So for the distant examination, we look for the general appearance of the cat. So either we observe three things, which are the body score condition, the gait and the behavior. So for the body score, we rate from 1 to 5. For 1 is the very thin animal and 5 is obese. So I can say this animal is around 4 to 5, which is around overweight or the obese, because we can feel the fat and loose skin everywhere. And then for the gait, we have to walk the animals, and then we look for, is there any lameness on the animals, or is there any abnormal in walking. And then for the behavior, normal animal should be alert and responsive and very bright. So if there is ill state animal, may not show the signs of normal one, which they may show dullness, unresponsive, or not alert with the surroundings. So after we have done with the general appearance, we are advisable to take the vital parameters, which includes the TPR. First, the temperature, the pulse, and the respiration. For the temperature, we can have our thermometer here, and then we on the thermometer first, and then we just put some lubrication, and we put at the rectal area for the rectal temperature, and then we direct the thermometer towards the wall of the rectum, so that and wait for around few seconds, and the reading will come out. So that is how we take the temperature on the animals. So the normal temperature for the cat is around 38.3 to 39.3. So is that if the reading shows higher or lower than that, it indicates abnormal. And then for the pulse rate, you can have your stethoscope, but I don't have my stethoscope with me right now. So if you have your stethoscope, you can take the heart rate around the left area of the heart and listen to the sound. If there are any murmurs, heart murmurs, or any unclosed of the valve, and any abnormal sounds that you may listen to. Or also you can take with the pulse around there, we can have a femoral artery, facial artery, or coccygeal. But for cats and dogs, we usually take at the femoral artery here, over here. So we just count around few seconds. We take for 1 minute, and then we can have the reading. And then for the respiration, we just look for the breathing of the movement of the abdomen. So we just count from there for the respiration. And then after that, we've done with the distant examination of the PE. I will continue with the close examination. So we start from the cranial parts towards the caudal part. So we start with the head first. We look for the skull. Is there any symmetrical or asymmetrical of the skull, which may indicate any tumors or any fractures in the skull area. And then if there is normal, we proceed with the eyes. We look for the eyes, and we check for 3 reflexes of the eyes, which first is the menace reflex, which is the sudden approach of the objects to the eyes, with the response to it. And then the papillary reflex, which we can have a torch or medical pen light, which we can shows directly towards the eye to see for any any reflex to the pupil. And then if that's normal, and we can check for the other one, which is the palpebral reflex. So for the palpebral reflex, you can just tap your fingers in the eyes. If this response to it, means that it's normal. And then after we've done with the head, we've done with the eyes, we further check the ears, and then if is there any presence of mites, or is there any discharges coming out from the ears, you have to check for that. And then we look for the mouth. We look for the nose first. Is there any discharges from the nose? If there is none, proceed with the mouth. Mouth, we check for is there any ulceration in the mouth area, or you can also see any mucous membrane. Check for the CRT, which is capillary refill time. That indicates normal for below 3 seconds. So if the CRT shows 3 seconds or upper, that indicates abnormal. Is there with the animal anemic or anything else? And then we have done with the head. We proceed with the neck. Just feel some more. If there any fracture at the neck area, any abnormal. And then after that, we move along your hands, along the abdomen area, along the body, to feel for any bumps, lumps, or any neoplasia that may be present. Also have a close check. If there any alopecia, that indicates a heavy flea infestation. And then proceed with the limbs, 4 limbs check. And then as usual, we normally start with the distal part first, and then we towards the proximal part. So check for the interdigital area, where is there any inflammation or ulceration, where may cause the animal's lameness, and is there any fracture as well. The paws is not injured, no wound. And then you examine whole part of the limbs. Same goes to the better check with both sides to check for any. And you can also feel for the lymph nodes if there any inflammation, which indicates infection. And then you've done with the 4 limbs. You check with the thorax area, which contains having heart organs and lung. You can have a stethoscope and listen to the heart sounds, and also the lung sounds to know the normal response to the animal. And then you've done with the thoracic. Move to the abdomen. You can feel the abdomen, which are having kidneys, intestine, and also the bladder. So you can feel, is there any abnormal bladder, or intestine, kidneys, for both kidneys. And then you have done with the abdomen area. Proceed with the thoracic, pelvic limbs, or the hind limbs. So these are just is pretty much the same with the 4 limb. We just have to repeat from the distal part with the interdigital area, and then go up to the metatarsals, go up to tibia and fibula, and goes up to femur, and go to the pelvic area. Is there any fractures? We check for them. And then you've done with the hind limbs. Check for the perineal area. For the perineal area, you might have you may check for if this is a female cat, you may check for the vulva. Is there any vaginal discharge or any abnormal discharge? Observe the coloration of the discharge if this is present. If there is a male cat, look for the scrotum. Is there any abnormal unilateral of the scrotum? But in this case, this animal has been castrated, so there's no the scrotum is not present due to it's been removed. And then we've done with the perineal area, and check for lastly we check for the rectum. Is there any diarrhea coming out from the rectum? And then the anus, check for the anus. And then you can have your, just now I said your rectal temperature. You just insert the thermometer inside with the lubrication, and then you take the reading. And I think that's all for the demonstration of the PE on the cat. So I think I'm done with the demonstration of the physical examination. With that, I say thank you.